Hi, my name is Verity and I'm an external student, and this is my presentation on not-for-profit organisations. This presentation correlates with a PowerPoint, and so I'll direct you when to move to the next slide. At the moment you should be on slide 1. My organisation report is on the not-for-profit health service Nindalingari Cultural Health Service, which is located in Fitzroy Crossing in the Kimberley region of Western Australia. Please move to slide 2. Fitzroy Crossing is located 4 hours inland from Broome in the Kimberley, Western Australia. The Fitzroy Valley consists of a central town called Fitzroy Crossing, as well as 45 remote Aboriginal communities from 4 different language groups. Those language groups are Gooniyandi, Wamulgeri, Bunaba and Yukunya. The Fitzroy Valley is a place with strong culture and traditional law. Please move to slide 3. Nindalingari Cultural Health Service was established in 1995 following an extensive community consultation that took place in the Fitzroy Valley. The consultation process was set up to establish what the local community's concerns were about their health circumstances, but also to review the existing health services in the Fitzroy Valley. Out of this consultation came a number of key issues. Firstly, that the people felt disempowered in their health circumstances. Secondly, that people did not feel comfortable accessing the existing health services because they felt intimidated or unfamiliar with mainstream healthcare practices, and they felt that services were often not sensitive to cultural protocols. And as well as this, there was a genuine fear that if someone needed to be relocated to a large hospital in Derby, Broome or Perth, that they were being sent away to die. This meant that most people were not only accessing health services during the worst case scenarios, but also when preventable problems had not been treated and got to an extreme state. And the final issue that came out of the research was that it was apparent that many of the health concerns in the Fitzroy Valley were actually lifestyle related and therefore are 100% preventable. So following this consultation, several key community leaders began discussing new innovation in the form of a health service that would represent the local community, bridge the gap between existing mainstream health services, and empower the community with the health education they needed to reduce lifestyle-related illnesses. Please move to slide 4. So the vision and mission of Nindalingari Cultural Health Service. The vision: to be the best provider in Western Australia of health promotion, early intervention and community services to Aboriginal people. And the mission: to provide culturally appropriate holistic health promotion, disease prevention and community services to benefit the people of the Fitzroy Valley whilst fostering the objectives of the Fitzroy Valley Health Partnership. Please move to slide 5. The management structure. So Nindalingari Cultural Health Service operates on a hierarchical management structure, as you can see in this slide. Ultimately, it's the governance committee that reviews the service. This takes place in management meetings as well as the AGM. The governance committee is made up of locally elected community representatives from the 4 different language groups. They review the programs Nindalingari is running and give feedback about community concerns about the organisation. The CEO has to report to the governance committee and explain any organisational decisions that might be in question. Please move to slide 6. So based on the concepts of social entrepreneurial orientation, Nindalingari as a not-for-profit is already very well established across all the dimensions. Nindalingari sets out its own style and pace to the work it does because it knows to deliver effective healthcare in Fitzroy Crossing and the Fitzroy Valley, health programs need to be culturally sensitive and tailored specifically to the people that live here. Many of the health initiatives take a really long time to set up in the Fitzroy Valley because it's essential to ensure first that the community is accepting of any of the initiatives. Nindalingari must come up with innovative ways to change people's health behaviours in the Fitzroy Valley. So a good example of this, you probably saw on the first slide, the picture of someone pulling a condom out of a cylinder. So that's the Condom Tree project. where canisters filled with condoms are hung in trees surrounding local social spots. And this innovation is really effective because there was a great deal of community consultation that went into it beforehand. And this innovation needs extensive community consultation to be effective. Many of the programs Ninjalingari develops are completely new, so there is always some risk involved to see if programs are going to work. Ninjalingari is a strong advocate for the style of health it delivers and has to represent itself constantly in federal and state forums to convince funding bodies that the way it operates is the best way to practice healthcare in the Fitzroy Valley. Ninjalingari is an organisation that is a very small fish in a big pond, and there are a number of larger health organisations in this area that are constantly wanting to take over the work Ninjalingari delivers. So Ninjalingari Cultural Health, as such a small organisation, is very competitive in the way that it operates, and it's the founders of the organisation that are still working for the organisation that persist to outside agencies, that outside agencies would never be able to do the job the best way for the people here in the Fitzroy Valley. Now the following 2 slides will attempt to outline how Ninjalingari could improve to stay competitive in the always changing and demanding field of healthcare. So please move to slide 7. So the structure of Ninjalingari is relatively complex. So not only does it have a number of health promotion areas, including alcohol and other drugs, nutrition, child maternal health, sexual health and environmental health, but it also manages an aged care facility and a HAC service. Please move to slide 8. So this shows the SWOT analysis of the strengths and weaknesses, the opportunities, and the threats for Ninjalingari Cultural Health Service. So some of the strengths are that there are local Indigenous staff working for the organisation, that there's a strong existing leadership from the original founders of the organisation because they're still working in the organisation and advocating for the organisation, and there's a really good commitment and strong work ethic of existing staff who 100% believe that the way they're delivering healthcare is a really effective way to deliver healthcare to Aboriginal communities. Some of the weaknesses is that there is a fairly high staff turnover rate because it's such a remote area, and also because of the transient nature of a lot of people's lives here. They're constantly moving from different communities, so it can be hard for local people to work in an organisation that is based in town but does outreach services. The heavy management of workloads of the management, creates a lot of pressure because obviously they need to be constantly advocating for the organisation and renewing funding proposals. So that's a lot of work for such a relatively small management group. And also the pressure of having numerous components to the service. So not only is it a health promotion service, but it also has an aged care facility attached to it as well as a HAC service. So that's a lot of different components to be managed. Some of the opportunities Ninjalingari has is the strong existing relationships with the local community. So it's really well established in the local community and is established by local community members. So that's a really strong thing that Ninjalingari has over other organisations. Its existing partnership with between Ninjalingari and the Fitzroy Valley Hospital and Population Health. So Ninjalingari often does work with the health services in town to explain to them different cultural protocols and any family situations that might come up in the hospital. Some of the Ninjalingari staff can resolve some of those issues and explain it in a different way to any of the patients. The good working relationship between Ninjalingari and the other local services. So Ninjalingari has really well established working relationships with all Fitzroy services. Ninjalingari also offers cultural awareness training to not just its own staff but also other local services and any visiting services that might operate in town. So that's a really important thing with linking services to local communities and getting people to understand how they need to respect any cultural protocols and traditions. Some of the threats Ninjalungari has are the constant changes to funding pools. Governments are always changing different funding for different programs, and that's what Ninjalungari runs off, so that can be quite difficult to keep up with and also keep renewing funding applications. The climate, obviously it's extremely hot climate, and during the wet season many of the communities get cut off from flooding and poor road conditions, and also many of the communities are just extremely isolated, so it's difficult to travel out to these communities on a really regular basis. Pressures from communities, so when issues come up in community, that can put a lot of pressure on Ninjalungari to resolve different community issues. Large regional bodies wanting to control the Fitzroy Valley, so there's obviously other bigger regional health services that would prefer to operate in the Fitzroy Valley, and Ninjalungari really has to compete with them to stay as the predominant health service provider in the Fitzroy Valley. And also there's a lot of visiting services that come into Fitzroy Crossing to work out in the Fitzroy Valley and run health programs, and sometimes this happens without prior consultation with community and existing services and existing programs. So please move to slide 9, strategic recommendations. So currently there are, the first strategic recommendation is that there's currently numerous external organisations providing services in the Fitzroy Valley, and as I said before, this is quite confusing for the local community and can lead to the communities feeling burnt out when there's no coordination of these services coming and going. Some months one community might have 5 separate services come and run programs, and then for the next 5 months see no one. So this is very frustrating, and this can be very damaging to the morale and the relationships with the community. So Ninjalungari really has an opportunity here to expand itself and be the formal gateway for other services in the Fitzroy Valley, to hopefully that will provide a more coordinated and consistent process, and also the programs Ninjalungari runs won't be threatened by external organisations. Moving to the second recommendation. So local staff are a key component to the success of Ninjalungari, to the programs and to the operation of the organisation itself. And Ninjalungari needs to work not only to encourage local people to work for them, but also to provide more upskilling and training and support future education, so that local people can really move into the more professional positions within the organisation and sustain it into the future. And looking at the final recommendation, so because of the sheer amount of communities in the Fitzroy Valley, as well as how isolated most of them are, some of them are 2 hours away on a 4-wheel drive track, so it's difficult for Ninjalungari to deliver consistent programs across the entire valley. So Ninjalungari needs to work on strategies to minimise any gaps in their service due to this problem. So thank you for listening to my presentation. I hope you found it interesting and you've got a good insight into how entrepreneurial organisations operate in a not-for-profit health organisation. Thank you.